Medicine was an art and science.
Yeah.
Well, I like the transition. I don't know if we include the old name of the hospital yet.
No,
that was
that's
nice
new,
to
yeah.
include
Community.
community hospital.
I didn't know,
general
but
clinic.
they didn't know that because I was the only guy, and Astrako and Ed and George were sitting on a table. And,
Yeah. Well, that'd be important to include in our timeline too.
Oh, yeah.
When
Yeah.
it became,
Yeah.
Community,
Yeah.
general to.
I can't remember when the retreat was. It was at the club in Mentor, near
Yeah.
area.
I don't remember when that was.
Yeah, I don't remember, but it was in the 90s, I think.
Yeah.
Or late 80s, maybe. I don't know. But it was a retreat at one of the country club.
Yeah.
So I just have one quick follow-up as I've been thinking about it. So you mentioned AI being like the future. And then we talk a lot about, the relationship with the patient. Do you see the whole AI type of thing being good or bad in terms of building a relationship with patients?
I think that's very bad as far as the patient-doctor relationship is concerned. We were not only patient and doctors, we were friends.
Yeah.
that was a similar comment most made. You see the people in church, or the grocery store, public events,
Yeah.
you have that connection to them.
There was some old, not in the thing, there were some old, very old people. One of them was a nurse's father, 95. He couldn't get out of the house. So he asked me if I would go and he had a farm up on the west side. I said, yeah, sure, no problem. So after office hours to go there, he had a huge big dog and the dog was very nice. He used to come and sit next to me. And they would make tea and we had sat down and before listening to him and taking care of him, we had tea.
Yeah.
You know.
It's interesting. I was talking about having coffee, and we got off topic. But this morning we have cups that I had left over from my practice, and one of the people who has just started coming here was looking at the cups, and it said Medina Eye Associates H. Lynn Nast MD.
Yeah.
And then there was the motto for our practice: we care for people, not just eyes.
Oh, okay.
And that's the whole point.
Yeah, I don't know what happened to my cup. You gave me a cup and I didn't, either my name rubbed off or whatever.
So we care for people, not just eyes, but you have to take care of your own cup.
Oh. Well, and the other thing that I see in medicine is what I'll call, doctors used to make house calls.
Yeah.
Now they go from one institution to another. So,
Yeah.
They make hospital calls.
yeah. So
Yeah.
hospital calls, you come to them, but okay, if you want to see them quicker,
Yeah.
I usually ask on any of the doctors, okay, when's the soonest? I don't mind traveling. So, okay, you can go to Euclid and see same doctor. If you want to wait 6 months, you may be able to get into, Medina Hospital. So they travel quite a bit.
They travel quite a lot. Actually, one time I was looking for somebody to see me, and they told me, the quickest you can go is to go to the clinic, downtown, not here. The relationship is going to go down.
Yeah.
It'll become a business.
Mm-hmm. Yeah.
And that's the problem. They are hiring physician assistants and nurse practitioners because they'll cost less than the doctors, and they will do the similar kind of work but not exact. So they try to get you to them first. Now, I am a little different. So I asked for an appointment. They said tomorrow we'll see you. A nurse practitioner will see you. I don't want to see a nurse. I want to see the doctor. That's why I called.
Yeah.
I mean, they might have been offended by me.
Yeah.
But if I want to see a doctor, I want to see a doctor.
Right. No, I agree.
Well, during all your rehabilitation, you kind of got a patient's viewpoint of the medical community. How many months were you in rehab? Like,
4.5.
Yeah. So you saw good, bad, or maybe
I saw everything.
Yeah.
The good news was that a lot of the nurses knew me personally, so they helped me a lot more than they helped other people. I'm not sure, but I got a little more treatment from them because they knew who I was. The nurses aide knew who I was. So they would wash me. I like to take a bath every day. You know,
I have to ask you a question. Did you learn your lesson to not climb up on ladders?
there's no ladder in my house now.
Well, thanks to you, my wife won't let me climb on a ladder unassisted either. So,
No,
you're
you
the
should not be on a ladder at all.
Yeah.
Let the professionals do that.
Yep.
You know, my wife threw the ladder the next day after I fell, and that was such a stupid thing. I knew it better than that
Yeah, I know.
to climb it, and that was my step ladder, not even my own ladder.
I know. The other thing is, I say, why do the doctors go 6 different hospitals to practice? I had my office in Medina next to the hospital. They kept bugging me, why don't you open an office in Lodi? Why don't you open an office in Wadsworth? And I said, I'm seeing patients in Medina, and I'm absolutely as busy as I can be. I'm
Yeah.
seeing all the patients I can see. The patients come to see me maybe once a year, maybe once every 2 years, except for emergencies, and we keep spaces open for emergencies.
Sure.
Why am I going to leave this office empty and go down to an office down here and spend my time driving back and forth when I can see that when they need to do it once a year to come from Lodi to Medina?
Yeah.
That's not that tough a drive for somebody to make it. I guess if you lived in South Dakota and it was 500 miles, but even then, it's much easier for the patient to do it once a year than it is for the doctor to do it every Tuesday or every third Friday. Or
I drive to Worcester for my regular position, and then my dentist is in Steubenville.
Yeah.
So,
So why not?
I'll drive.
Yeah, why not?
My experience was I opened the office for 1 year in Lodi. They wanted to build the cardiology, so I made their intensive care unit with the nurse cardiologist over there, and Dichoso. He wanted me to come there, so I opened office over there. I went there for 1 year. It was such a waste of time.
Oh yeah.
How did you ever diagnose the thyroid conditions prevalent in Lodi?
I
What would have been the root cause of that?
I have no idea, but there was a congregation. When you see something in one spot, I had a lot of patients from Lodi, and I'm just examining them and doing some medical. I was doing internal medicine also, and their thyroid was underactive, and I said, "How come this group in this area has underactive?" Although the government of the United States had already put, iodine in bread and all those things. So they were supposed to stop, the underactive thyroid. And I was impressed by the number of people. Similarly, this is really off the thing. I diagnosed one patient with Lou Gehrig's, them, But after that, I found out there were 5 patients around here, Medina. 5 of them. I diagnosed only one of them, but he was a good friend of ours, unfortunately. But there were 5 patients with Lou Gehrig's.
You just gotta wonder if it's environmental or is there other
We don't know.
issues?
But usually thyroid was supposed to be iodine, and all those things. But the government had already taken care of that, and yet the number of patients from Lodi coming around here with underactive thyroid.
Did you ever find a common thing?
No. I mean, they're all living the same way. They ate the same kind of food. So
Yeah, I'd never heard that before, but that's an interesting.
it just impressed by, in 1979, I saw that, and I was impressed by, I had a lot of academic fields at that time, so I just picked it up, Okay.
Good.
Thanks,
You did a good
Jay.
job.
Yeah.
Thank you.